Hello, everyone, and welcome to our final summary evening day of the Pet Pain Relief Summit. And I appreciate all of you attending. Hopefully, each day there was something that you were able to take as new data that you can use to help your dogs with whatever pain situations going on. So just to recap a little bit, day one was about understanding pain syndrome. So I started off with the 4 pain pathways, helping you to realize it's really a broad spectrum body situation and how that can be addressed at the different stages. And then Dr. Bill shared with us the importance of chiropractic and having those joints totally moving, especially when it comes to the atlas, that C1 joint. Dr. Edward, he talked about silent pain and how, especially with cats, that you really don't notice it, and many dogs that they can hide different stages, so you can finesse with that. And then Dr. Elaine was bringing to light a lot of the different situations that are related to the teeth and how important the dentition is in regarding pain and how that can affect the whole body. Again, a global situation. Then day 2 was topical and external approaches to pain. So Dr. Janet, she's the essential oil vet. So she shared a lot of good information and options of what you can do that way. I really like the availability of being able to diffuse. A lot of times it's an easy way to introduce some healing without having to go through the mouth again, like other supplements and pills and all that, especially for those that are a little bit stomach irritated at the time. Laurie Edge Hughes, she's always so much fun. She talked about physiotherapy, doing different exercises to help with pain situations. Dr. Roz shared with us a lot of different therapies that she uses in her practice and has for lots and lots of years. And then Dr. Ruth, we were looking at there what to do when the doctor says that your animal doesn't have any pain, but yet at home you know that there's some kind of pain somewhere going on. They just can't find it. Then day 3, we had inflammation and pain relief. So Angela was sharing with us about mushrooms and approaching pain, that perspective. Dr. Judy was talking about her PIA product. Dr. D, homeopathy. That's another area that can, with a little bit, do a lot. Dr. Doug, he's one of our sponsors for this, and he was sharing with us his turmeric and the benefits of using the gold paste. And then day 4, we looked at pain that's caused by a lot of different common conditions like ear infections. So Dr. Katie shared with us her approach to treating and cleaning ears to help with that. And then Dr. Barbara, we talked about degenerative joint disease and different in practice methods that are being done to help, like the underwater treadmill post-op and for arthritic patients and that kind of thing. Then Julie Ann shared some essential oils that she uses with cats. And Dr. Janet, her holistic approach in her practice over the decades with using different types of modalities and therapies and exercises and support. All righty. So those were our 4 days. And I'm guessing somewhere along the line, there's some good questions that have come up, something that you want to talk about with your animal or friends, anything that has to do with pain. I'm here to be able to shed some light on that from my perspective anyway, or maybe refer you to another source where you can get some more data on whatever it is the situation is. And it's always fun when we get to that point that others out there kind of join in, share some of your ideas too. So it's an open platform. Anybody can hop on and bring up any subject they want. One of my favorite programs that I do really is about the harness fitting and how that can totally interfere with good body function and create pain in other areas that you may not realize. So we have a question here. Any suggestions to help thinning hair? This is a 12-and-a-half-year-old female senior Yorkie. She was spayed between 2 to 3 years ago. So she had her estrogen progesterone for quite a while. Increase the amount and or frequency of bone broth offerings. Well, I don't know that bone broth is going to actually change the thinning of the hair, but it's always good. I mean, you could do bone broth twice a day if you wanted. The thinning of the hair really is an endocrine, and generally it has to do with the hypothalamus. And that's one of the endocrine glands. It's not talked about a lot just because there's not a lot that traditional veterinarians have in their arsenal to handle, but it is part of that HPA axis. So when you hear about the hypothalamus, pituitary, adrenal, they all communicate all the time. And then there's the communication from them to the thyroid as well. So hair thinning generally goes back to the hypothalamus. So if you're in a country where you have standard process available, there's 2 products that are proprietary. There's the hypothalamex, which is cytosol extracts from the cytoplasm of the cells of the hypothalamus. And then there's another one called hypothalamus PMG, which is the PMG stands for protomorphogen. So that's it's a protein mineral moiety that comes from the DNA that's released, and it circulates around the cells and helps keep a balance in the body between the cell growth and the natural tissue antibodies. And it's really a growth regulator. But as an individual gets older, and this is the same with people, that the protomorphogens are not being produced at the same rate or the same level. So that's when aging and degeneration of the cells actually begins. And this is the same with people, especially you see women with hair that's thinned up at the cap. That's generally a hypothalamus related endocrine problem. Then there are some herbs that are good with helping stabilize the hypothalamus. So Gatucola is one of those that helps in that area. So those would be some things to do, but I'm looking at it from one endocrine, but you don't want to just isolate out. You have to look at that whole spectrum, the hypothalamus, the pituitary, the adrenals, and the thyroid. So there are some products that have a culmination of all of those that oftentimes helps booster that entire system. It's not just an easy, here's one thing, here's what you do. And it can take a little while too for all of that to happen. It's not something that you're going to see change like right away, like within a few days, but certainly by 6 weeks to 3 months, you should start to see some more fur coming in, a little bit of fuzz. The texture may not ever be exactly the same, but you do start to see some growth. The other thing, sometimes too, doing different kinds of the alpha stem microcurrent. I've had that before where we were using it across a joint, like say post-op or with an injury where they'd been shaved and had surgery, like a knee surgery, hip surgery. And the area where they were doing the alpha stem microcurrent through that to help that heal faster, the fur also grew back there in that area. And around it, it wasn't to the same length as in that particular zone. So other things out there that can help with that too. All righty. While we're waiting for some other questions to come in, I'll just kind of go through our list. Chiropractically, making sure that all those joints are moving, just restrictions alone of a motor unit is going to create some pain in that area. So that's where we get trigger points. So you might be petting your dog, cat down the back, and you hit a certain area and the skin crawls or they move away from it. That's an indication of pain too. And so an area that's not moving, you're going to have other areas beyond, above and below, that become hypermobile because they're trying to take up the slack of the area that's not moving. So being able to keep all of those joints of the spine in normal function and mobility is very, very important to reducing that aging process, keeping them comfortable. And there's any kind of an accident. So, certainly playing rough with other dogs, but being hit by a car, even any kind of surgery, having a dental, a lot of times a TMJ joint from having the mouth opened and the speculum in there and the trach tube and all of that, and then getting worked on and moved. The TMJ, just like with people, can become out of its perfect alignment. And so then just like today or yesterday it was, I had a dog in and the client said, well, just been yawning. The dog had been yawning frequently, a lot more than they'd ever noticed. And the left TMJ was off. So there's a lot of different signs that you can look for, and you might just write it off, but you shouldn't, because it can definitely be an indicator of something. So good chiropractic adjustments is really important. The silent pain, being aware of your animal's normal behavior, however they've enjoyed you petting them, what's been their normal movement and activity, and get used to looking at their posture, how their back alignment is, or if they're dropping low in the rear while they're still potentially, got a bug here, going to be getting up and moving. The fact that they're not moving like they did before, it's slower to move, any kind of hesitance, change in their posture, all of those are indicators of potentially pain in some area because of whatever the changes are, but there'll be pain associated with that. Essential oils for pain. Okay, good. We've got a question here. The dosha quiz on the website. Oh, okay. She says half the page doesn't display. It feasibly could be because it's on your phone. That's definitely a possibility. So maybe you can borrow it from a friend, or if you want, the Post program, and the senior one had that too. The Post program that we have coming up for pain, that one does have all of that document in there. But if you want to just email me, and then I can forward you the quiz, and then you can do it from home. Well, it's still, it'll be in a way that you could probably open it up on your phone. I'll say it that way. Yep. So you can just email me. All right. Dr. Royal addressed over medicating pets in pain with drugs. Is it too much to use carprofen as needed? No, that's an okay way to go. So like, you know that you're going to go hiking, do extra walk, or the dog cousins are coming over to play. And so you've got concern about getting too much activity going in one day. That's fine. You can use carprofen as needed. And oftentimes it doesn't have to be the full weight dose. Like a 60-pound dog maybe could do fine on 30 milligrams as opposed to 60 milligrams. Adequine. Now, generally, adequine, when you start, you do it more frequently, but then as time goes on, you generally get to the point where you can reduce it to like twice a month. I don't know how far into your treatments you are, but usually it's as you go, you don't need it every week consistently over time. So I would look at that, and maybe that would be another area of something that could be adjusted. And then the PIA, those are fine. I don't know what the Jump for Joints is, but I'm sure that's a product that's glucosamine, chondroitin. So those last two, you might want to check and make sure you're not overdoing the same thing. So do they both have MSM? Do they both have Boswellia? Do they both have hyaluronan? Do they both have glucosamine, chondroitin? You know, they might be very similar. And the problem would be if they both have vitamin C, the body needs a lot of calcium to help with the joints. And the ascorbic acid is a vitamin that we use when there's too much calcium in the body and we're trying to pull it out. And that's rare in dogs. So I would be very cautious about overdosing the vitamin C. All right. So Marty says that her dog was on twice a month, but that her joints are so bad they suggested weekly. So did you see a change when you went back to the weekly? Is she better now? Can you see improved movement? And then I would also then check those products, because that is a glucosaminoglycan. Now, some dogs can't actually process it by being absorbed. You know, they don't process it right through the gut. And that's why the injectable works and the other doesn't. But if your products don't have hyaluronan, that's another one I would look at. So that's the hyaluronic acid. Hyaluronan is in the Trixin. If it's a big, large dog, there's a lot of equine formulas that have it in there. And so you can dose smaller and becomes less expensive. It would still be an equally good hyaluronan product. So that would be another thing I'd think about for her too. I was waiting to see if we got an answer back on whether or not when they upped it. Oh, she is better. Okay. Yeah. So then, Marty, the other thing I would say is just to check on those last two products and compare their ingredients. And if they don't have the hyaluronan, you might want to look at that too. But it may be if both of those have the glucosamine and chondroitin that she's actually doesn't do a good job of absorbing it from the gut. So that's good then that the Adequin actually is helping her. That's real good. All right. Janelle asks, what can my dog take instead of gabapentin post-operatively? Okay, so gabapentin is the active ingredient that's in poppy. And so if you want to do it from an herbal perspective, Cordalis is that. So the scientists took the active ingredient out of poppy and then made it into a chemical. And the problem with that is you run into more of the gabapentin, which it doesn't treat the joints. It's only working at the brain level to stop the pain response, the pain reaction, or the recognition of it, reduce pain at the brain level. So it doesn't cut inflammation. It's not stopping inflammation or making any change at the joint itself. But you can use Cordalis instead of gabapentin, and if without getting the druggy ataxia and all of that. But also, if it's just short term post-operatively, I mean, aside from the Cordalis, which works fine, that's really good. You've got the Boswellia, the MSM, or some kind of an NSAID. If your dog doesn't have a problem with that, I would go to that short term because at least you're reducing the inflammation wherever the surgery was, not just stopping the pain, unless it's a terribly excruciatingly painful procedure. And then maybe a low dose of gabapentin with something else, or use the Cordalis. It's Corydallas. Okay, so Marty is the one we were talking about the Adequate. So a 60-pound Labrador, 13 years old. So that's really good. That's really good for a Labrador, 13 years, and sounds like you're managing the arthritis pretty well. Oh, it was a hematoma. Okay. So Janelle says it was short term. It was ear hematoma. Yeah. So, I mean, probably hurt more while the ear was large than what it does post surgically. But I would still want to do something for about a week because it takes a while for that to heal. And ears are very sensitive because they do have every body part mapped in them and they're very vascular. But it probably doesn't have to be gabapentin. That's one of the ones I use. I would think about that more like with bone surgery or something like that, or big, huge open abdominal surgery. Okay. So the adored beast jump for joints is calendula arnica. Okay. And then the ruta, whatever that one is. I haven't used that product, so I don't know. Like, I like the ingredient there, at least the first two I'm aware of. Yeah, so it would be one of those things that if you use it and the animal improves. Now, arnica a lot of times is more for the acute situation and not necessarily chronic ongoing. So it may have maxed out on its value. You'd have to see, maybe stop it, or at least when you get to the end of your bottle, check it. Don't order it right away and see if you notice a difference just by stopping that one, because it may not still be doing anything in that situation. Thanks for sharing that. Alrighty then. I will proceed onward until we get some other questions coming in. Let's see here. We were talking about essential oils. Okay. Yeah. So frankincense, which is Boswellia, is a good essential oil for pain. And I've got a mental blank, but Janet was really good about running through Copaiba. That was the other one I was trying to think of. Yeah, and there's others, and you can make blends, and there are some that are already in blends. You can apply it topically. It can be diluted, applied that way. They can go in diffusers. And sometimes as a blend, and then you just work with it and see. Not every body appreciates everything. Exercise, I'm a big proponent of exercises. And it's good to start them earlier in life when there's a little problem, and maybe you can keep it from becoming a great big issue. But even with a senior, you could have a 12, 13, 14-year-old that's developed problems and doing those exercises. So looking at the posture and helping support the abdominal muscles in the top line, or doing a nice square sit again, as long as their knees aren't super bad, or their hips. If you can get them into that square sit, that helps strengthen those gluteal, the buttocks muscles, and get those stronger, which then helps them elevate instead of them pulling so much from their front end. Even doing massages and just range of motion to help keep the fluidity going to those joints instead of letting them get stiff. So that's very beneficial. And they're easy things you can do. Even just doing the light balancing exercises, getting them in a neutral position and gently rocking them back and forth, side to side and front to back and on the diagonals. That helps with their balance and their proprioception as well. So just little things like that can make a difference. And when you get that motion going and the circulation, and you're taking the good things in and bringing the bad things out and getting some fluidity, just stiffness can go away, and then the pain from that stiffness. Other therapies? Okay, let's see here. Another question from Marty about nutrition. Okay, the same 13-year-old 60-pound Labrador has chronic pancreatitis. Oh, what commercial food? Well, that's a big story. But if I'm just going to take the food perspective of it, Raised Right actually has a lightly cooked, it's a pancreatic, help is good for helping with pancreatic issues. Yum Wolf, their turkey, the little pellets, the perfect food that they have, the one that's called Perfect, the Yum Wolf. At any rate, that turkey one is one that can help with the pancreas. There's a lot of different reasons that the pancreatitis becomes an issue. A lot of times it's a liver something that's triggering that too. The Chi Dog also has foods that are created for that are really good. I realize a 60-pound dog, you might not want to, you might hesitate to do the lightly cooks or the air dried or dehydrated, but it will make a big difference because the extruded diets, if you're looking at those kind of foods, that extruded kibble is part of the problem that's creating the pancreatitis. So changing another brand is still not eliminating the 47 to 63% carbohydrates in that food, which would be part of the issue. Okay, lots of good questions. I'm glad you guys are here tonight. Alrighty, therapy. So I'm sure by now, mostly everybody is, I can't imagine anybody not being aware of the benefits of laser, especially low level laser that you can use at home. You get the pads, the patches that you can apply to the areas. It's about repetition, and the low level at repetition is very beneficial, especially when you're looking at older ones, trying to get them in the vehicles to take them to the vet to have a 5-minute session of a high level laser. You can do the same benefit and better even sometimes in many of them, especially not having to haul them around if they struggle to get in and out, the larger ones, or if they get nervous when they go there. Well, that's not good for the adrenal glands and the sympathetic system geared up, messes with their energy. So energy, cellular energy, not their mojo necessarily, although it can do that too. So yeah, even doing warm compresses, cold compresses, I mean, simple things like that. Doing warm in the morning to get those joints going and get the circulation moving, 10 to 15 minutes of a warm compress over a bad zone. And then at night, doing a little cool compress to lower any inflammation that got set up by the day, whether it's along the spine or the neck or a specific joint. You can do a lot just with that. I think Gindy had a question she posted. Okay. Patty says, I need to get off prescription glucose diet for my diabetic dog. Yes, I would agree with that. What is a good fresh diet for a diabetic dog? Well, you're kind of going back to the same pancreatic type. So definitely no rice. Rice is very glycemic, and lots of articles out about brown rice being high in arsenic. So number one is, if you have any grains in the diet, then they need to be those low glycemic. So that's oatmeal, millet, barley. So if you're going to have a grain in there, those are the only one. Rice is very glycemic, so you got to get that out of the diet. You can do fresh food diets, and you can make it yourself if you want to cook for your dog. And there's the animal diet formulator. So it's if you just Google up animal diet formulator, there's a whole computer program that you can log into. I don't know what the purchase price. They have a bunch of different programs, scales of how you can sign up if you want to cook for them at home, and that's really good too as an option. But otherwise, the same ones I was mentioning, Raise Right Diet has one for diabetics. Any of those pancreatic, also liver is very key in a diabetic patient. So I'd be looking at things that were liver supported, organized in a nutritional program for the diabetes. So either a liver diet or a pancreatic diet to help with the diabetes. Definitely no rice. And there's a lot of them, good ones that are out there, whether you're okay with a lightly cooked or the air dried or the freeze dried. All of those are home cooking. All right, Jess says, I am feeding my dog small batch. Okay, and solutions. Okay, those are both good. And I often feed the food cold straight out of the fridge. Okay, so is that bad, or should I feed it warm? And then I heard cold food can hinder function of spleen and stomach. So, it's not as much of a problem if your dog is young and if their oxidation rate is like really high. They have high metabolism. The only way you're going to know that is if you do the fur tissue mineral analysis test. So you would need to do that, and that would be an indicator of, do you want to feed warmed food or is it okay cold? Now, that's for younger dogs. When you get to the older dogs, then generally, because you're moving down in your energy production, same way with older people, it's not good to drink your water cold. It's not good to eat the food cold, because then the stomach has to warm it all up, and you waste a lot of BTUs in heating that food when the body needs that energy somewhere else. But because the food has been presented and it now has to process it, it'll pull that concentration of adding heat into that area that could be energy, just like turning a light switch and how electricity, how many amps do you have, that kind of thing. So those all get less. The amps get lower when you get older. So if the animal is older, then it should be warmed. And the thing about it is, you can say, well, I let it warm up to room temperature. Well, that's okay. That's better than being refrigerator or frozen. But room temperature is still not the dog's temperature. Their body temperature is 100.5 to 102.5. So if you got it 68 in the house, well, that's better than whatever it is, 45 or 50 in the refrigerator or frozen. But it's still not as warm as what their body system is. All righty. Moving on. All right. So Dr. Ruth's program, just kind of going through my list, remembering things that we did with these when I was sharing conversations. Some of them, I was there with them at the time, and other ones they presented on their own. But yeah, it's a difficult situation when you go to the veterinarian and you know that there's something not right, but you can't exactly put your hand on it. But you know that your dog or cat isn't comfortable at home. And yet, because they've ridden in the car, because their adrenal glands got excited, or because they're afraid, and that short period of time that the doctor has to look at them, and especially if they're not in an area where they can actually take them out of the building and do some walking, get them out on grass, get them on different surfaces, do some walking, trotting, stop, sit, turn, all of that. And then the other thing too is that depending on the doctor's skill level, I know from chiropractic and exercise, and certainly Dr. Edward would be talking about this too, is that you have to gently move. If you move an area too quickly, you can sometimes override that point where the problem is, because the body will move too many parts at once. Of course, if you go too far, then you may get into that area where they scream because it's too much. But other ones are very stoic and they don't act like they're in pain because they're happy and they want the biscuit or whatever it is. So being able to stick to your guns, and certainly programs like this that give you the power to know of other things that you can do to help support the painful body that your animal has. How would I warm the food? Well, you don't want to put it in the microwave, that's for sure. So I just do it in a skillet, or adding hot water helps too. It just depends. Like if you already have it at room temperature and you add some boiling water in there and stir it up, that would be fine because that'll raise that temperature too. Otherwise, I put it on the stove and then warm it up that way. If it's raw or refrigerated food that you're warming up. Okay, let's see here. So, mushrooms, there's a lot out about mushrooms nowadays. Okay. All right. So the comment is, that's interesting about food temperature. I've been feeding your soon to be 13 her mostly raw diet at room temperature. Yeah, well, that's good. Like I said, room temperature, sorry, is better than refrigerated or frozen. So that'll get her there. And again, if her metabolic rate is fast, then that's not so bad. To be cooled down a little bit is not terrible. But if she's one of those that's pretty slow in other ways, and again, the only way you truly know is by doing the fur tissue mineral analysis test. All right. Very good. Oh, so talking about mushrooms. So there's going to be some mushrooms that target cancer better than others. Some mushrooms are going to target intestinal, digestive. Some mushrooms are more on the immune side. So you have a lot of variety with mushrooms. It doesn't mean you have to throw all of them in there. And just speaking about the immune system too, pain definitely wears on the immune system. The longer that pain goes on, the weaker the immune system can get. Mineral wise, zinc is really important for supporting the immune system, as well as calcium is important for the immune system as well. So it might be that adding some different minerals in there can help support the immune system if your animal is at that stage where you're doing everything you can, but yet you know they're still in pain. Well, that's going to wear and tear on the immune system. So sometimes you just need to do a little booster. That doesn't mean you need to go all out with a whole lot unless they're one that continually has infections and you're having problems with whatever, tick disease or things like that. Then we'd want to booster that immune system a lot more. But otherwise, just doing a little bit of a support, a little bit extra for the immune. There's certainly essential oils that are good for the immune system, the mushrooms for the immune system. There's other things like that you can do to help support different herbs, even to help with the immune system and just support it. Some of the tonics, the herbal tonics, herbs that are for helping tone the body and support general like that are really good. Alrighty then. Turmeric, a good program on the benefits of it and the different avenues. Now, certainly it's another one of those, just as with all herbs, you have to be really careful who you're purchasing them through. Make sure that it's a company that does test the product. If you can get organic, Banyan Botanicals, theirs are organic, and they've got a great program. They've even, some of their herbs now have been cleared for being used, like insurance will pay for them now. They've got that verification, at least in the United States. So you can go to banyanbotanicals.com and learn a lot about the different herbs that you can look at to help. So in regards to all herbs, you want to make sure that they've not been adulterated, that they are being tested, they're coming from a manufacturing company that has good standards, quality standards, and all of that. And turmeric is one that can be used in cancer situations, good for helping with inflammation and a lot of different healing processes. Jess asks, how can I go about seeking a consultation with you to ask questions about my dog's health? He's 4 and healthy, but I just have some questions to make sure I'm doing all the right things. Okay, thanks, Jess. So you can go to my website. It's lifeextendmethod.com. So www.lifeextendmethod.com. And there you can email me, and then we can set up a consult. You can purchase a consult from the website, depending on, I do them in 15-minute intervals, and then we can set up a time to talk if you want to. Yeah, we can do that as a starter. I might ask for some documentation or something, depending on what it is. 4 years old, it can't be too bad. So yeah, that'd be cool. Thanks, Gindy, for putting that up there. All right. Ears. Oh my goodness. Poor dogs. The dogs, the hound type dogs, the cockers, any dog with ears that hang down where especially where there's a lot of fur growing in and out and around the ears, the weight of those heavy ears hanging down. And then if you live in an area where you have a lot of humidity, they're just a trap for that cave, because the dog's ears, cats too, ours just go in horizontally, but theirs have a canal that goes down and then it turns and goes in. And so that creates more of that environment down there deep where water can get trapped and microorganisms like to prevail, especially in a body that's really alkaline. So the alkaline environment where the pH is a little bit higher, the yeast and the microbes will be able to grow and flourish. So that's a real problem. Some things that I like to do, so on those hounds with the ears that hang down, I like to pick up that pinna and I shave. I take the clippers and I clip around the base of the ear so there's no fur there. And generally the hound dogs are not the ones that grow the ear out, the hair in their ears as much. But if you have hair that in the breed that grows out of the ear, you certainly want to keep that plucked. But then I take the clippers and I clip the inside of that pinna, and that helps it be lighter. It helps it lift it up so you can get some air in there. And then using that swimmer's ear, if they're not raw ears, this is not good. But just as a prophylactic, using that mixture of isopropyl alcohol and vinegar. So we're going to acidify the ear, we're going to dry it, irrigate them, and then you use a cotton ball to pull out, you stuff it down in there and massage it around and then pull that out. If there's any grunge on there, you can do that a few times. And then even just using a blow dryer on low to help dry the ears out after you've been swimming, that kind of thing. If they've been in the water or after a bath, that will also help to cut the moisture. You never want to put hydrogen peroxide down in the ear, and you don't ever want to put water down in the ear either, because that's part of the problem. So there's a lot of different products out there, but there's some simple ones like that you can target and use. You got enough places to spend your money on. If there's something that you can do that's economical, then let's all go for it. All right, so this is a 5-year-old, won't eat his eggshells in his breakfast. Well, I guess he doesn't like them. I don't like eggshells in my breakfast either. There's a lot of other ways to get good quality calcium in. Okay, he's 3-legged, and I worry about his joints and bones. Well, one thing will be making sure that he doesn't get overweight, but they do shift and change. Chiropractic adjustments would be really important for him, and also some exercises. Depending on how big he is, a harness to help him doing some balancing things too can also be good. Any suggestions for calcium through food? Well, there's not any food that you're going to feed just food-wise that's going to get enough of the calcium that they need. And I would refer you to my website. If you go to the section on fur tissue mineral analysis, there's a study that I had published in 2017. It was on 564 different dogs, and looking at 94% of the population are very low on calcium and magnesium, and you don't just supplement one of those. So there are a lot of good calcium magnesium products out there, but you have to add that in addition. It's not going to be, there's no food that's going to have enough of what they need. MSM is good. He's 5 years old. So yeah, MSM can help for inflammation. It helps a lot of ways for inflammation. Glucosamine chondroitin, well, at 5, depending on the breed of the dog, he may not need that yet because the joint that was bad, there's no joint there anymore. So if the rest of the joints, if the dog's healthy otherwise and isn't overweight at 5, those joints could totally be making enough glucosamine and chondroitin, and so the excess is not necessary. So you have to decide on that. And if you give it and they don't need it, they're going to pee it out. So it's kind of it doesn't benefit grass either. So, not the thing that you need if they don't really need it. Now, in a situation where there's a 5-year-old dog that had an open joint surgery, like say you have a dog that had a knee surgery, not necessarily the TPLO, but if we're talking about like a patella surgery, or if you didn't have the TPLO, but you had the extracapsular technique done on a cruciate tear, then yeah, those dogs are going to get arthritic within 2 years. So in that situation, I would say yes to the glucosamine chondroitin because the joint was opened and it was traumatized. There was already something wrong. You had the surgery. You've got all of that change in there. But otherwise, if they're not overweight and not a large breed dog at 5, they may not need the glucosamine and chondroitin. Alrighty then. Okay, so I was talking a little bit about the ears and pain and things that you can do in addition to whatever else you already know. And then looking at other degenerative joint diseases. We talked about with Dr. Barbara Royal about the underwater treadmill. Super beneficial. One of the things about the underwater treadmill is making sure that if your dog is in there, that they learn to walk correctly first before they speed it up and get them trotting. The trot, moving fast, is a whole different gait, and it doesn't use the joints the same as walking. So some of mine, they would walk. I mean, maybe that's all they ever did, but it was better than moving into the trot. You've got to get a perfect walk before you start doing the trot. It's not about going fast. It's about them doing it correctly and using all the body parts. And then, of course, being in the water is nice because they weigh less. So you got the buoyancy of the water and the function of that on the lymphatics and everything. So that is very beneficial. But just making sure that the walk is perfect before you get into thinking about speeding it up. So that'd be a thing on that one. A lot of people do the pulse signal therapy. That's another area that's now handy to use at home. So that's another thing you can do. All right. So Jill's dog has several different things going on his left side. Interesting. His skin and ear is more inflamed on that side. So I would, if you haven't done chiropractic adjustments, I'd be thinking something with the atlas in the neck. There's something there. I would definitely look at that first. His hip on the left also seems to bother him more on the left than the right. Yes. Now, yeah, definitely chiropractic. You got to get some body alignment and get assessment in that regards. I would also had he ever had a head trauma? There's other things that could cause that side to be more out of balance, but I would definitely start with a chiropractic. We don't have acupuncture in here. Acupuncture is very good too for helping to balance both sides of the body. So this might be one where chiropractic and acupuncture both would be what you would want to do. And I would start with the chiropractic because that's going to give you the bulk instantaneous and get a few of those on board and then schedule and start doing the acupuncture to help from there with the finesse. But that's feasible. People can be that way too. And then there's also exercises you can do to help then with the contralateral side, but it definitely needs to be diagnosed better first. Thanks, Kindy. Okay. It says, with supplemental omega-3 oils for my dog with chronic pancreatitis, are there any you'd recommend or others? Or with the fat in the oil, could it cause a flare? Yeah, there's a whole lot to pancreatitis. It's not just about the fats, but I guess my thought would be by now you probably know if the omegas, if by giving those oils you see them flare up. And I would be thinking more about using the medium chain triglycerides, which is in the coconut oil. So you definitely, fats are really, really important for protein digestion. The body needs fats. Otherwise, it's all going to be coming from carbs, which then is going to be sugars, which that's not good for the pancreas either. Most often with the pancreatitis, the organ that's missed is the liver. I would really focus on the liver and the gallbladder more than what you've been doing. Any chronic pancreatitis shouldn't be chronic. I think the liver part is maybe being missed here. And I would look at liver gallbladder for sure to help reduce that. And then I would look at the medium chain triglycerides as opposed to the other fats. So hopefully that'll help with that one. All righty. All right. So, okay. So Jill says, I'm wondering if something is going on energetically or structurally on that side might be causing the symptoms. Sure. That's why I say chiropractic and then acupuncture. Yeah, that's right. That's what I'd said with what you mentioned. Probably the atlas or the occiput is off. And I'd even be thinking with that, the TMJ, probably those three, maybe even C2. But until you get that handled, it's going to be a struggle. So find a good chiropractor. You can go to AVCA, V as in Victor, CA. So it's American Veterinary Chiropractic Association.org. So avca.org. And you can find, I think there's also a site, AVCA Doctors. And then you'll have a map, and then it'll list different certified doctors. So they may be veterinarians that are certified or chiropractors that are certified in your area, because you're going to go to the map and then find a doctor that's been through the right training and has proven that they've got the skill level and understand it well. And then that would be a starting point for you if you don't already have somebody that you're familiar with. And then you can talk to other friends that you have with dogs and find out if you know somebody else that's been to one that they like, that they've had good success with, then certainly use that doctor. All right. Jill says it's possible that he was an adopted dog. Yeah, so that is possible. The vet said he had a tooth knocked sideways. Oh, on his left side. So now we've even got more potential trauma. I still would do chiropractic and acupuncture. Those are still the places to start to try to get things straightened out. And the body, and then, like I said, there's exercise, just like you do with people. You can retrain the brain and you can get the connection to the other side. But you've got to open up all of those nerve pathways. You've got to facilitate that nervous system to be able to do that. And it would only come with the chiropractic and then the acupuncture. All right. Very good. Okay. Other holistic approaches to practices. I have added in the acupuncture that we didn't have a program for that in here with pain, but that would be the only other thing that I can think of that's missing. If you've listened to all of the days, if you listen to all 4 days, pretty much we've covered every gamut of an area of something that can help in lowering pain, creating a better quality of life for your dog, and hopefully making the pain be short term, taking those chronic situations and turning those around as well, and reducing that level of pain that they have. And a lot of what we discussed works for cats. Certainly, they're not out there doing agility and hunting and things like many of the dogs that the dogs are doing. Well, cats hunt if they go outside for mice and birds and other critters and crickets and things like that. But I'm talking like hours of hunting, or dogs that do search and rescue and things like that. So, but a lot of this works across both species too. A lot of things you can do. Cats are really good at hiding things until it's too late sometimes. So making sure to check their mouth, check their teeth. There aren't problems there. And yeah, if you're petting them and their skin's twitching or they're uncomfortable, have they gotten crabby? They didn't used to be crabby, and now they're crabby. Well, that could be a cat that's uncomfortable and painful too. And also, as they get older, their ability to turn around and groom themselves becomes less, and that can also be if they're overweight and they can't turn around and groom. And so if you think about the fact as they groom, they're really keeping, it's an exercise program for cats. They're keeping their body very supple in all the different directions that they move as they groom. And if they're not grooming, then they're not doing their exercises every day. And so they too then can become stiff and stagnant and develop adhesions in areas if there was any kind of a stretch, a tear, something like that. So keeping that circulation going by keeping the exercise. So their grooming is a big exercise, as you know. The leg goes up, they roll around, they turn. Yep. Cat exercise. All right. So we're coming to the end here of our recap for the Pet Pain Summit. And we've got, what was the website to find a chiropractor? So it's avcadoctors.org, avcadoctors.org. And then you can go to the American Veterinary Chiropractic Association. If you put in those words, if you Google American Veterinary Chiropractic Association, then it will come up as well. We're getting ready to have our annual conference, which I'm going to do some presentations there and be an exhibitor as well as attending. It's actually going to be in Branson, Missouri this year. So that's a spot that they haven't had it before. Close enough for me now, since I'm in Missouri, that I will just drive. Won't even have to fly and pack everything. So it's going to be fun. All right. Patty says her holistic vet was adamant my diabetic dog can't have fats and oils. Not even let me put castor oil on her skin. Well, that's pretty silly. What do I do for omega-3s? She said medium chain triglycerol is a big no to ketosis. What can I do? Well, I would say maybe you find a different veterinarian. I realize that there's different styles of holistic vets as well, but maybe find out, I don't know what her nutritional or his, whichever, so her nutritional background is, how much she's really studied the balancing nutrition. And ketosis is, again, a liver thing. So the whole thing is liver. So I would be looking at liver support for your diabetic dog. And then even just like we talked about, getting off rice and things like that, anything that adds to that. And diabetic dogs can have fats. There's nothing about fat in diabetes. That's sugar. Fat's not a sugar. I don't know where she's coming from on all of that. Yep. Okay, can I answer one last question? Yeah, it says we got 6 minutes on my clock. Is the MCT, so that's the medium chain triglycerides. That's what comes from coconut oil. So when I'm doing my scanning, coconut oil is very, very good. And there's some recent research out in using the medium chain triglycerides in senior dogs. And Dr. Busby, who has the toe grips, we talked about those in one of the programs, I'm sure, well, at least in the senior one. But the toe grips, Busby's toe grips, she actually has a product now. So she's got a lot of information about medium chain triglycerides. Also, if you go to Yum Wolf, you can find the book there that I have a chapter in the book that is on the Yum Wolf page, and it's about the omega and cocomega effect. So using omegas from the coconut. So I would suggest getting that book and reading about it too. So reading Dr. Busby's research article and reading that book, and you'll have more information. So, but there's nothing wrong with the coconut oils. Other ones that when I do my testing oftentimes works is flax oil can be a good one. You just have to make sure it doesn't get rancid. You keep it in the refrigerator and buy it in smaller volumes, not larger. So flax could be an option. Olive oil can be another option. On ones that don't have a problem with dairy, ghee can be really, really good. all of those, as well as the coconut. Those would be my main ones. Oh, and avocado oil. A lot of times that one will read up as an option too. So I'd look at those as some of the ones that you could research. Okay, can I put the name of the book in the chat? Yeah, it's the Cocomega Effect. But if you go to yumwoof.com, YUMWOOF.com, you can order it right from there. And there's a page. I mean, it's easy to find. Just go to yumwoof.com and then it's right there. You can order it. And you're very welcome. All right. What is my thought on Interceptor? Just 3 times a year during the summer. Doses it every 45 days. Okay, and then follows with a week of milk thistle. I'm okay with the Interceptor as long as it's not Interceptor Plus, and I don't recommend doing it year-round. The tablet, any of those preventatives for heartworms, it will treat 30 days back when you get it. When you give it, it treats 30 days back. So there's a timeline in the strategy there to make sure that you don't get too far removed from that when it had it and then when you give it back. So it's that range that is why you can do a little bit of playing with your timeline there. And milk thistle's always good for the liver. So that's all fine, as long as it's the plain Interceptor, not Interceptor Plus. And I use the tablets, chewable chunks. Sometimes animals, like if you did the heart guard with the chewable chunk, ones that have sensitivities and allergies, sometimes they have more problems with that. So the Interceptor is my go-to, but not the Interceptor Plus, just the plain old Interceptor. So I think you're doing fine with that. And I'm guessing that you check for heartworms annually anyway. So you're finding out, you would catch it early on because of the program you have. So at least you're treating during the worst time of the year when the mosquitoes are at their height. All right. Well, okay. Again, thank you all for being a part of the Pet Pain Relief Summit. There's so much to know, but so much you can do. And I salute you for taking the time to educate yourself and to learn and to be the best caretaker that you can, the best spokesperson, the best guardian of your animal, that you've taken good responsibility in being able to do for them what may not be offered to you. So kudos to everybody who's been a part of this. And I always have fun doing these. I enjoy helping to educate and sharing. And there's a wealth of knowledge out there. Lots and lots of things that you can find, products when you Google. It can be very, very confusing. So coming to the Pet Summits programs and getting teams of doctors and nutritionists and physicians and exercise physiotherapists and whatever the categories are of all the different Pet Summits programs, they're always educated individuals in their field who know the detail. They know the ins and outs of what it is they're speaking about. So it's a really good source. All righty. Gindi, I don't know if there's anything else I need to say at this point, reminding you guys there's always other Pet Summits that come up. I appreciate you being a part of this one. And if you are interested in learning more, we have that extended program, the Post Pain Relief, that you can sign up for and learn even more detail. It's like being in a private classroom of mine. So we go into deeper, share some other things with you, explain things in more detail. So there's that as an option as well. All righty then. So thank you all for being here. Thanks for giving up your time. And I appreciate all you very, very much. And thanks to all our sponsors and to the team at Pet Summits. Oh my gosh, they are such a great group to work with. All righty then. Happy trails.